8 changes that will help you prevent kidney disease. If there is one issue that constantly bothers our mind, it has to be our weight. It is a struggle to meet our desired result. While some stay focused and determined to stay fit, several others give up and ignore keeping a check on their weight. According to several global reports, obesity is becoming one of the major factors causing death worldwide. It is not just impacting adults, but children as well. Putting on a little weight once in a while is alright, but it shouldn't become a habit and cross alarming levels. Obesity doesn't just concern the issue of being overweight, it is one of the major underlying causes of several other diseases such as diabetes, hypertension, heart attack and even kidney failure. Kidney diseases are on the rise in India. According to reports, the number of Indians suffering from chronic kidney ailments has doubled in the past 15 years, and at present 17 in every 100 citizens suffer from some form of kidney disease. Kidney is an essential organ in the body. Its primary role is to remove toxins and excess fluids from the body through urine, and also maintain a good balance of body salts and other chemicals. It is also involved in controlling the production of red blood cells and regulating blood pressure. So how do we prevent kidney failure and other ailments? Here are some pointers. 1. Obesity is a lead cause. Obesity is becoming a growing worldwide epidemic, and is expected to affect more people in the years to come. One's lifestyle habits, particularly sedentary lifestyle, are adversely impacting health. According to researchers and authors of the study, Obesity and Kidney Disease, Hidden Consequences of the Epidemic, obesity is one of the strongest risk factors for new-onset chronic kidney disease, and also for nephrolithiasis and for kidney cancer. As stated on the official website of the campaign, a growing body of evidence indicates that obesity is also a potent risk factor for the development of chronic kidney disease, CKD, and end-stage renal disease, ESRD. People who are overweight or obese have 2 to 7 more chances of developing ESRD compared to those of normal weight. Obesity may lead to CKD both indirectly by increasing type 2 diabetes, hypertension and heart disease, and also by causing direct kidney damage by increasing the workload of the kidneys and other mechanisms. 2. Cut down on red meat. According to a study done by National University of Singapore, they found that participants who ate the largest amount of red meat had about 40% greater risk of developing kidney failure compared with people consuming the lowest amounts of meat. Our findings suggest that individuals can still maintain their protein intake unless their kidney function has been severely compromised. However, to reduce the risk of end-stage renal disease, it is best to eat red meat in moderation, said the lead author of the study Woon Pui Ko. 3. Good sleep time is crucial. According to a study done Brigham and Women's Hospital, shorter sleep duration can lead to a more rapid decline in kidney function. Many of the body's processes follow a natural daily rhythm or so-called circadian clock that is based on regular sleep-wake cycles. The study found that kidney function may be compromised when this natural cycle is disrupted. 4. Hypertension ups risk. About 20% of India's youth suffer from hypertension, which makes them 40% more vulnerable to kidney damage and cardiac arrest. There is little understanding in the country of hypertension, also known as high blood pressure, which usually does not cause symptoms but gradually affects various body parts. As many youngsters do not get to know that they are hypertensive, they continue with their sedentary lifestyle, said Girish Manwani, Senior Consultant, Internal Medicine, Saroj Super Speciality Hospital. This slowly and steadily damages the kidneys and heart apart from giving rise to various other problems. It could even be fatal. 5. Say no to junk food. According to a study by Anglia Ruskin University in Britain, a diet that relies mostly on junk food or processed food may cause long-term damage to the kidneys and trigger diabetes. Type 1 and type 2 diabetes both induce changes in glucose transport in the kidney, but junk food or a diet high in fat causes changes that are very similar to those found in type 2 diabetes, said Havavai Chichkar, lead author of the study. 6. Cut down on sugar. Dr. Anshul J. Bharat, a Delhi-based nutritionist, says, most processed food products contain too much sugar, so when it goes to your system it leads to hormonal imbalance and also your blood profile changes. High consumption of these empty calories can cause obesity and diabetes, diseases that directly impact the functioning of your kidneys. You can treat yourself to your favorite dessert or a fast food burger sometimes, as long as it does not replace your daily balanced diet. 7. Keep a check on phosphorus intake. Health experts and doctors have issued a warning against excess phosphorus in the human body, claiming that it may increase the risk of chronic kidney disease where the phosphate levels in the body shoot up to abnormally high levels. According to them, muscle cramps, numbness, tingling, bone or joint pain and rash are all the symptoms of hyperphosphatemia, and people who experience them quite often should consult a doctor at the earliest. Foods that should be strictly avoided, or at least consumed in moderation, include soft drinks, chocolates, tinned milk and processed meat, suggests Neerja Jain, who works in nephrology department at Ram Manohar Lohia, RML, hospital. 8. Pollution is to blame as well. According to a study by George Institute for Global Health, climate change may be accelerating the rate of chronic kidney disease caused by dehydration and heat stress. The research paper, published in Clinical Journal of the American Society of Nephrology, JUSN, suggests that a condition called heat stress nephropathy may represent a disease of neglected populations, but one that may emerge as a major cause of poor kidney health in the near future. How to maintain healthy kidneys. You probably don't think too much about your kidneys, and that's a good thing. It means they're working, and you'll want to keep it that way. Having kidney problems can result in a variety of health problems, and can also lead to fatal kidney disease. The purpose of your kidneys is to remove waste from your bloodstream, among other functions like producing urine, so you can imagine what might happen if that mechanism failed. Here are 7 ways you can help your kidneys remain healthy and efficient, and assist them if they're already experiencing problems. 1. Stay hydrated. Water is an important component for all bodily functions, so it's a good idea to make a habit of having a glass of water when you can. However, the Cleveland Clinic says while you should hydrate, you shouldn't overdo it. The clinic adds, contrary to popular belief, no studies have proven overhydration as an effective practice in enhancing kidney function. That doesn't mean more water will do any harm to your kidneys, but you may find yourself spending more time in the bathroom as a result. 2. Eat a kidney-friendly diet. The National Kidney Foundation suggests being wary of the kinds of foods you're putting into your body, which, again, is a healthy habit to get into for your overall health. The foundation said a kidney and heart healthy diet consists of less sodium, an ample supply of fruits and vegetables, and omega-3 rich foods like salmon. The source also notes you should try to reduce the amount of processed foods you're eating, which can be easier said than done, as well as knocking down intake of saturated fats found in foods such as eggs, whole milk, cheese and fried foods. 3. Get moving. Your kidneys will perform better when you perform some exercise, according to Chatelaine magazine. The source notes that kidney health can get a boost through yoga. You don't have to give up exercise if you already have a kidney issue. In fact, multiple sources recommend the opposite, and encourage you to stay fit to assist your body's functions. Talk to a doctor about taking on an exercise program or continuing with one that you're already on following a diagnosis of chronic kidney disease. 4. Keep the pressure off. The National Kidney Foundation says that blood pressure is important as it relates to kidney health, and you may be prescribed medication to help with this. The foundation also notes the medications most preferred for those with existing kidney disease are called angiotensin-converting enzyme, ACE, inhibitors or angiotensin receptor blockers, ARBs. Taking in too much fluid and salt can also increase the load on your circulatory system, so be sure to talk to your doctor about limits for each. We already covered exercise, but we should also mention that's a great natural way to keep blood pressure under control. 5. Take it to heart. The National Institute of Diabetes and Digestive and Kidney Diseases notes that if you have heart disease, you could be at higher risk of kidney disease, and vice versa. This is because they share 2 main causes, diabetes and high blood pressure, notes the source. In fact, the Institute notes, heart disease is the most common cause of death among people who have kidney disease. You can be tested for kidney disease through a blood and urine test at your doctor's office, notes the source. The blood results will show your glomerular filtration rate, GFR, which indicates how efficiently your kidneys are functioning. 6. Beware of supplements. While vitamin supplements can be beneficial in some cases if you're low in some areas, taking too many can actually have a negative effect on your kidneys, according to the Cleveland Clinic. The same goes for herbal extracts, it adds. The best course of action is to be upfront with your physician about any supplements you're taking. Also, be aware that some over-the-counter supplements can interact with medications and cause a variety of side effects. 7. Quit smoking. This one pops up a lot referring to lung and heart health, but it's no different when it comes to your kidney health. Smoking can constrict and damage blood vessels, lowering the amount of blood flowing to the kidneys. WebMD explains that smoking can boost risk of kidney disease in diabetic patients, but can also lead to potentially dangerous changes in kidney function even in otherwise healthy people. Some sources also say that smoking can prevent blood pressure medications from doing their job properly.